Everyone.
Good morning.
So we're at 8:59 and you all know how I am about time. So hopefully we'll be able to get a quota for our action items. Mimi, can you give us a count to see
So,
where we are?
yep. So far, so our quorum is 10. I'm gonna do roll call really quickly. So if anybody could just, speak up. I'm gonna start with school member Katie Blacksburg. Okay, Michael
We have we
Christian.
have we have people joining, so let's do this. Let me
Okay.
go ahead and call the meeting officially over. I have 9 a.m. So we're gonna go ahead and call to order today's COC Board of Directors meeting for July 10th. And I want to thank everyone for being here. And so at this time, we're now, you do know on the agenda, we always provide the COC mission and vision. And we're hoping that you have the opportunity to read the vision and to understand what the mission of the COC is. And again, I want to thank everybody for being here in the month of July, which is one of the hardest meeting months for a lot of organizations. But again, we're hoping that the virtual option has proven to be a little bit more convenient for everyone. So again, thank you so much for being here. So now we're going to go ahead and get into the agenda. Sherry, did you want to say anything, or can we go ahead and move into it?
I believe we can go right into roll call and move forward.
Let's go right into
Thank you.
roll call. So if you would, Miss Mimi, go ahead with roll call, please.
Absolutely. Okay. Katie Blacksburg. I see your name in the chat. So Mark is here. Do we have Mike Cretion?
Sorry, I'm here. I'm just having some technical difficulties. I'm working on it.
No problem. Thank you. Is Mike Cretion with us yet? Yeah, I'll look out for him. Dr. Monica Discolo, are you with us yet? Okay. Janina Voley. Okay, and we have
She is here.
Good morning.
Good morning. Thank you. Councilmember Fix Sanders is here. Do we have Lieutenant Haish?
Here.
Good morning, Lieutenant Haish. Do we have Michael Gelazzo?
Here.
Good morning, Mr. Gelazzo. I see Teresa Jones.
Present.
Good morning, Miss Jones. Do we have April Lott?
No,
She said she wasn't going to be
She
here
wasn't.
today.
Okay, thank you. Ashley Lowry. Okay, do we have Kevin Marone yet?
Here.
Good morning, Mr. Marone. Do we have Jason Mathis? Okay, and Miss Sandra Newsom, are you here yet? Okay, and I know we have Commissioner Vince Nowicki. I saw your name in the chat. Good morning.
Good morning.
Good morning. And I know we have Miss Ashley Rora. I saw your name, correct?
Yeah.
Good morning. And then Ross Silvers.
Present. Good morning.
Good morning. And Mr. Gary Small, I know, is here.
Good morning.
Good morning. Do we have Dr. Smiley yet? Dr. Joseph Smiley? Okay, and then last but certainly not least, do we have Judith Warren?
Miss T has her hand up.
Yes.
Thanks, Madam Chair. I just wanted to remind everyone we are required to be on camera, I believe.
That would be nice, but I'm not going to press it today. I just want us to get through the meeting.
Thank you.
We do have quorum.
We do have quorum. How
Yes.
many do we have?
We have 11.
Yay. Thank you to my 11 and my quorum. That I do appreciate. I do. So now we will actually be able to conduct business so that we can, we'll give you your day. And if you can go on camera, we appreciate your professionalism and come on camera. So the next thing on the agenda is the consent agenda. And on the consent agenda is the approval of the COC board meeting minutes. Did everyone have the opportunity to review the minutes? Hearing no corrections or changes or comments to the minutes, we'll entertain a motion to approve the minutes.
Move approval.
Is there a second?
I'll second.
Who is that for the minutes?
It was Teresa Jones on the motion.
And who is on the second?
And Gary
Oh, and Gary
Small.
on the second. Okay, very good, very good. Thank you. So all in favor, signify by saying aye.
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 Those opposed? All right, thank you so much for that. So the next item, if you have your agenda in front of you, is the chair vote. I'm going to introduce it, but there is a couple of caveats with this. Again, those of y'all that know me, at the final hour, Sherry and I were actually speaking, and you know that we are in the charter review. And if you've had a chance to look at the strategic plan, one of the things is to update the job description. Well, I'm also an elected official in this capacity, although I sat in as I was appointed as the vice chair, because right now we don't have a vice chair. So we have a couple of options in ratifying the executive committee's recommendation of me being the chair of COC. Currently, right now, the job description says you can't hold two positions. So we have option. There's a lot of things in the charter that we haven't actually followed to the T, but myself wants to be one of those and lead by example. So we have a couple of options that we can do in Kevin Marone, because I can't facilitate the vote, but I wanted to preface where we are with the chair's vote. So one, we could ratify the executive committee's vote to have me voted in, ratified by you guys as chair. Two, I can remain interim if you're not comfortable with moving forward until the end of the year. Three, I can also be voted in until with the sunset date of January 31st. As you know, as an elected official, and I know Avery was here during the part when Amy was chair, but as an elected official, we're appointed to these particular boards. So until we actually get the job description of our charter change in the strategic plan, which we hope to have done by January, right now I'm holding two positions. So either way, at the end of the day, I'm going to have to, I will have to resign as vice chair. So with that preface being said, are there any questions? And whatever the motion of the body will be, of course, I will accept, but we do have those three options.
Can I just make the motion that you are chair of the COC effective May 1st?
You can if you get a second and the board ratifies it.
I'll make a
He
motion
has
to
a
make Deborah
second.
Fig Sanders COC chair effective May 1st, 2026.
Thank
All
you.
right, so we have I guess this is where I have to jump in, Deborah.
Yes, you do. You do.
So we have a motion on the floor from Michael to establish Deborah Fig Sanders as chair. Do I have a second?
You have a second, sir.
Second from Gary.
Yes, sir, it is.
Any comments or questions on that?
I think she'll make a wonderful chair. That'll be my
All in
comment.
favor, please say aye.
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 Any opposed? Motion passes.
Yay. Thank you guys for your vote of confidence. I appreciate that. I promise to try to do my best and do a good job. So now we're going to move
We can ask for her.
Thank you, Gary. Thank you, Mike. Thank you, everybody. So now we're going to move into our board member appointments. We have three, and I think two, Sherry, you said couldn't be here today, but that's okay. We're still going to go ahead and vote on their appointments, because I did speak to Mr. Lundy from the St. Pete Housing Authority, who had a conflict today. And so does anyone on the board? And please raise your hand, and Mimi, please help me see if I can, so I don't miss any hands.
Yes, ma'am.
If there's anyone that has a question about any other appointees, and so let me read their names. Commissioner Donna Hoke from the city of Largo, Commissioner Elise Minkoff from the local housing authority. She will occupy seat 1. And Michael Lundy from the local housing authority. Those are the 3 appointees to COC. Does anyone have any questions, comments? I see you, Ms. Jones. You have your hand up. Yes, ma'am.
Yes, ma'am. Thank you, Madam Chair. The question I had was related to Elise Minkoff. Wasn't she on the board?
She
I
was.
guess she had dropped off or resigned or something.
No, the tyrant previous chair kicked her off.
Be nice.
Well, it's true.
Be nice. Be nice. So yeah, so she is willing to come back, and so we're slate clean doing it, and so we're welcoming her. But yeah, she was originally on the COC.
So, in light of Commissioner Nowicki's comment, the question I now have is, was she removed for lack of attendance or?
It was attendance, if I remember correctly. It was
Yes.
attendance. It was attendance, if I remember correctly.
Okay, and I assume that she's committed to be
Yes.
more diligent in attending the meetings.
Yeah, I think there are some things that we were working out, trying to navigate through that whole process. And one of the wonderful things about a refresh and a restart is that you don't go back, and that's why they call it a refresh and a restart. So we're looking very forward to having Ms. Minkoff back and moving forward with our strategic plan and making COC the best COC we can. So again, so thank you for that question and comment.
I have a second question, Madam Chair, and
Yes, ma'am.
that relates to Mr. Lundy. Was he not previously on the board as well?
No, he wasn't.
Okay, thank you.
Yeah, you're welcome. Any other questions, comments? Seeing none, I'll entertain a motion to accept Commissioner Donna Hoke, Elise Minkoff, and Michael Lundy as new board member appointments.
So moved, Madam Chair.
Second.
Okay, who was second?
Vince Nowicki was second.
Okay, Vince Nowicki was second. So Ms. Jones motion, Vince Nowicki was second. So now we're going to go ahead and go to our COC funding.
Madam Chair, do you need to take a vote on that?
Oh, I didn't vote. I'm so sorry. All in favor? I thought we voted. All in favor? I'm looking at my agenda. Signify by saying aye.
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 Those opposed, raise your hand. I just want to make sure. I see no hands raised. Okay, motion passes, and we're going to gladly welcome our new commissioners. Thank you, Ms. Jones, for keeping me on point. I'm moving ahead, looking at my agenda. Thank you so much. Ms. Sherry, are you ready for our next item, which is the COC funding and our programs with the FY25 renewals and the FY26 NOFO update?
Sure. And would you be the nominating committee membership as well, right before that?
Well, okay, I'm looking at a different agenda. I don't have the nominating committee on mine, but please go ahead and update that.
Okay. Maybe if we could go back. So nominating committee membership, we have volunteers who have come forward: Judith Warren, Commissioner Vince Nowicki, Michael Gelazzo, Gary Small, and Dr. Monica Discolo. And it was requested to have this put before the board for action to accept this slate.
Motion to approve the nominating committee membership as presented.
Second.
It's Kevin and Gary.
We have Kevin and Gary. Okay, so with all in favor, okay, Sherry, I see the nomination application on here. So all in favor of our nominating committees, and can you read the names again, please, just for clarification?
It's Judith Warren, Commissioner Vince Nowicki, Michael Gelazzo, Gary Small, and Dr. Monica Discolo.
Thank you. And there's no one else interested in the nomination committee, correct?
Those are all the applicants.
Okay.
Unless someone wants to come forward today. Last chance.
Speak now, forever hold your peace. All right, with the names being said and the slate presented, and there was a motion and a second. All in favor?
Aye.
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 Those
Aye.
opposed? Well, welcome to our new nominating committee. Thank you so much for wanting to step up, and we will have executive committee meeting immediately following this. And so we'll go ahead and start scheduling dates for the nominating committee because we do have a timeline already disclosed. So we'll go ahead and work from there. So again, thank you so much for that, Ms. Sherry. And I turn the floor back over to you.
Okay, COC funding. So as everyone knows, the HUD COC program NOFOs have gone out. If we could just go back, we can stick to the agenda, Mimi, it'll be fine. Thank you. So for renewals, I sent out an email to everyone a while back just to let everyone know that we did receive all FY25 renewal projects are going to be contracted by HUD. Many are already in process. And what this means is that any of the projects that have expired anytime during 2026, HUD math is different. Anytime during 2026, then those projects will be renewed for a full year. And so that was $6,722,947 that goes into our system for permanent supportive housing, rapid rehousing, domestic violence services, and housing, and also for infrastructure for the COC and for our HMIS and coordinated entry. As far as the FY26 NOFO update, so we are well underway with 3 NOFOs, to be honest with you. So 3 NOFOs. The first one, the COC program NOFO, that is the big NOFO, the one that we typically have every year. And we have the local competition project supply. And then there is a review and rank committee. Projects are selected, they're ranked. They go on to the board and executive committee for final vote. And then these HLA, we pull together a full consolidated application on behalf of the COC, and then we submit everything to HUD. Those are due in August 26th. And our process right now is we've had the applicant conference, and also all of the requests for applications have been put out, and those are due July 16th by the applicants. So they've had a few weeks to work on them. The review and rank committee is scheduled for July 31st. That was just finalized from noon to 4. We added an extra hour just in case as a buffer because this is a different year with we anticipate many new projects to apply, new agencies to new providers to come on board. We also have the COC Builds NOFO that request for applications has also been posted on our funding landing page for the COC. Those are a very quick turnaround. There have been a few COC Builds NOFOs that have come out since October. No, that's when it's due. Since summer of 2024. And so there has been good amount of time for projects to get site control, and it's for new permanent supportive housing units to build for construction, rehabilitation, or acquisition. And so any project that is ready to go, those are the ones that are going to be the most viable. So with such a quick turnaround. So that request for application has gone out. We have the due date for July 15th. And then we will be submitting that up to HUD well before the end of July. Finally, we have the youth, and so I don't have to use acronyms. It's the YHSI, Youth Homeless Systems Improvement grant that we are going for. The HLA, the collaborative applicant applies for that. We've been able to identify 6 young people who've experienced homelessness in the past to be a part of the project and the process for putting that application together. Again, another very quick turnaround. But this is intended to give us some planning time, working with young people to come up with a good project that addresses youth homelessness in Pinellas County, and so that we can be very competitive for a youth homelessness demonstration project down the line. So those are 3 NOFOs, same time, very just throughout our summer. And so it's pretty exciting, a lot of work, but just so everyone knows that's what we're working with right now. And beyond that, as far as the NOFOs, exactly, the HUD priorities have changed. We've discussed this now for at least a year. And so now transitional housing, more balanced portfolio with the COC is coming on, is the goal. And so transitional housing, street outreach, standing supportive services, treatment and recovery services are now being funded through this program. So HUD has opened those up, and they're less restrictive on our tiers than the previous NOFO over the winter that was withdrawn. And so we have 60% is available to us for 60% of our total amount that we may have available, which we do not have that information yet from HUD. 60% though is tier one, and that means that is least competitive. Tier two is nationally competitive for those funding. So 60%, we will be dedicating more towards those really important programs that provide permanent housing to people with disabilities and to our infrastructure. Okay, any questions?
Any questions? And again, I'm going to respectfully ask if you can turn on your camera, if you would, please. That was one of our requests, hopefully, to go virtual, that we would be willing to meet our professional obligations by having our cameras on. And so if you can, I would appreciate it. Anyone have any other questions of Sherry in regards to our HUD CLC programs and our homelessness grant? So I got ahead of myself, everybody. If we can go back, one of the things I'm actually looking at my agenda on my desktop now. I was looking at my phone, and I don't know why I did that because I can't see. But item 4, I've had the discussion with the executive committee, and it is a recommendation. These meetings are scheduled from 9 to noon. It shouldn't take us 3 hours to do anything. So I'm hoping if we run efficiently and start on time, that 9 to 11 should suffice. So I am asking for your approval to change the meeting time from 9 to noon to 9 to 11. And I will gladly entertain a motion for
I will gladly make the motion to change the meeting time from 9 to 11.
And I second that motion.
Thank you. All in favor?
Aye.
Aye.
Those opposed? Thank you. Those opposed? All right. So now we'll be meeting from 9 to 11. And with efficiency and awesome planning, we may finish before then. So now we're moving into item 7, our Pinellas CoC policy to promote substance use recovery. And that would be you again, Ms. Sherry.
Okay, and this one comes directly from the Notice of Funding Opportunities, so NOFO, and it is where HUD is their direction for policy, and so this is something that we are recommending to adopt. It is the language, again, comes straight from the NOFO, and it deals with promoting substance use recovery, so any COC project that, or any project that receives COC funding would follow this policy, and to ensure that there's substance use recovery and services available to people who need that assistance, as well as has some language around harm reduction. And we stick to what the language is, what HUD has provided, and how it's defined in that policy. And so, and just within the parameters that are available there. So I'd like to ask if there are any questions around that. Yeah, Teresa?
Thanks, Sherry. The only question I have is related to Narcan, which I don't believe is considered an illicit drug.
It is not.
Okay, thank you.
Yes. And I will be, this has been a conversation too around Narcan and also clean needles, injections, and those are considered, so the injections are considered drug paraphernalia. And so injection sites will not be, or sharing clean needle distribution sites would not be eligible if an organization engages in that for HUD funding. And so that that has been clarified. I'll be sending out some more information between the substance abuse, mental health, SAMHSA, the long acronyms, the alphabet soup there. They have some guidance on that. We also have Florida state law, federal law, and so those are. I'll send out some updates, especially to providers and funders and everyone on the
So,
board.
if I understand you correctly, Narcan is not uh, considered an illicit drug, right?
It is not.
Okay, thank you.
It's acceptable.
All right, thank you.
Does anyone else have any other questions? Because we definitely want to be a resource, but we also want you to leave these meetings with your questions answered.
Hi,
Any
this is
questions?
Sandra. Sorry.
No, that's okay.
Couldn't find the mute button. Sherry, do you think were you were at the conference National Alliance this week, correct?
I'm still here.
Oh, you're
Yes.
still there. Okay. Because I know that what Therese is asking is a big question on harm reduction. It might not be considered illicit, but it's up in the air. And I don't know if there was any clarity because HUD hasn't been clear on whether having Narcan on site is considered harm reduction.
I will pull up. We did not get our answer. We send out questions to HUD. And so other COCs have had the same question, and there have been responses back from HUD that have been shared, as well as SAMHSA, and they have a Dear Colleague letter that addresses a lot of this as well. Narcan is not considered an illicit substance.
Well, I know it's not an illicit drug. It's really comes around harm reduction.
The harm reduction and that's why sticking with just the language that is presented in the NOFO by HUD that discusses drug paraphernalia, distribution sites, clean consumption sites. Those are the areas that HUD has specifically said. And they use quotation marks for under the guise of harm reduction. So it wasn't saying harm reduction was bad, it says considering those harm reduction, according to HUD language. That those were the things that were covered under that and not allowed.
See, but we had this debate again last month, and actually Lourdes and Tim went back to the adjustments in state statute because there's the state statute, and then there was an adjustment to state statute related to needles specifically. We're not gonna. There's no point in arguing needle exchanges because we're the only organization doing this, and at least for now we won't go after HUD funding, even though we've had more than 1,500 Narcan reversals in 3 years and it seems to not be terribly important, even though that means those are lives that have been saved. But we'll put that aside for a second, and I will say that state statute in that vein was altered as it relates to needles. It doesn't, it's just it's not a correct interpretation to say that it's paraphernalia anymore. But it's irrelevant because this is really going after needle exchanges, not specifically, and then putting all that under the guise of harm reduction. I think that the fentanyl test strips are probably a bigger question, but I don't know if that was asked either.
I will send out more information on this, but again, that's a federal program, so it'd go by federal law and not state law. But Narcan is still considered to be okay.
Currently, if I may,
Yes, go ahead, Gary.
fentanyl test strips for some reason are considered paraphernalia. I personally hand them out in the homeless community, trying to make people aware that it's finding its way into everything and they cannot trust their sources, and trying as best I can to stop accidental overdoses and things of that nature. But currently, like, the health departments cannot distribute that because it's considered a paraphernalia. And all it is for a detection device, to detect whether or not it's in whatever they're using at the point. But currently, I am familiar with that, and they do consider paraphernalia. I still offer it to most of the homeless events and hope that people will be more aware that it's finding its way into everything. So,
Okay, and thank you, Gary, for sharing that. Do we have any other questions or comments? This was an action item, and it is a recommendation to adopt the COC policy language consistent with the fiscal 2026 HUD COC program NOFO, promoting substance use recovery and clarifying practices prohibited under current HUD guidance related to harm reduction. And if we have no other question, I'll entertain a motion to accept.
you have a motion to accept?
Second.
Mr. Small and Ms. Jones, all in favor?
Aye.
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 Those opposed?
Aye.
Are you in favor or are you opposed? Oh,
I'm
Michael,
opposed.
you're opposed. Okay, so we do have an opposed, Mr. Creasy. The motion carries. Thank you. Sherry, the next item, the adoption of a housing-focused approach. It's on you.
Okay, and again, so moving away from housing first, which is something that HUD has been made very clear in its policy direction. There has been many discussions with funders and providers councils, and Sandra may have more to add to this as well. She provided the housing focused language considerations document that was attached to give funders, when putting together contracts, some ideas of how they may approach what a housing focused approach looks like. And so we are asking for and recommending replacing housing first references in all COC policies instead of going through every single policy procedure and plan that we have in place. HLA staff can go through and strike out housing first. It is not just a language replacement. It is a difference in approach, of course, but it may be more refined and accurate in its understanding and how it's used in language. So would go through all of those documents and replace that with housing focused.
Did everyone have the opportunity to look at the attachment to see what we're about to vote on? Because the recommendation is from HLA, the funders, and the providers councils to adopt a housing first service approach for the COC, replacing housing first references in all COC policies, procedures, and public communications. The proposed approach reflects current HUD priorities and emphasizes permanent housing, housing stability, and individualized supportive services. That is the recommendation that we are entertaining for a motion today. I'll entertain a motion if there are no questions.
I motion to approve.
Thank you. Is there a second?
I'll second. Janine.
I was.
Who's the second? Janine is seconding.
Janine, yeah.
And who motioned? I'm sorry, was that Sandra?
Sandra, I think. Yeah, I think it was Sandra.
It was me.
It was me. Okay, sounds
Sandra,
good.
me.
All in favor?
Aye.
Aye.
All in favor?
Aye.
Aye.
Okay, those opposed? So there's the motion passes. There's a question in the chat asking, will there be a resolution or memo for jurisdictions asking us to change our housing first policies? Sherry?
Yes, we can send that out. It would be we will share exactly what the COC has just passed.
Okay, sounds good. Does that answer your question, Dr. Sliker? I see your thank you.
Yes, it does, ma'am. Thank you all.
You are so welcome. Mimi, can you put the strategic plan up, please? Did everyone have the opportunity to review the strategic plan? Because I want to briefly go over this because these are some of the main mission and objectives that we're trying to accomplish over the next couple of years. We want to, number one, bring the COC up to date with certain items that need to be adjusted and reviewed. And we did start this process last year. And so we're hoping to have this done in the near future. So as you see, the mission statement hasn't changed. The vision statement is still there. Our priorities are still there. And that's the resources and our system framework, as well as our recognition and trust. And I think those three priorities, as far as where we are moving forward, is going to be vital in the success of COC, as well as getting new organizations to join the COC so that we can strengthen our collective. So when we talk about the strategic plan overview, the priority areas, again, if you can take it up, Mimi, the priority goals, objectives, as we said, is to number one, enhance the Pinellas CoC funding resources, as well as our processes in conjunction with our lead agency. And as you see, we have the defined strategies. I'm not going to sit here and read all of this to everybody because you do have the opportunity to actually go through the strategic plan. And this is what we've worked on for a while. We've worked on this for a while, and we wanted to at least present it. And hopefully, you've had the opportunity. Somebody needs to be muted, but hopefully, you've had the opportunity to go over what the strategies are, so that we can actually move forward with implementing the strategic plan. And it is an action item today so that we can work on this. But again, I'm not going to go line by line with you on the strategies for this. But if there's anything that you found in your own personal review that you would like to highlight or bring attention to or comment on, I would gladly entertain those questions at this time. Because it's a 9-page document. There's quite a bit of information in it. We tried to make it as concise as we could and as clear as we could. And we provided timelines and who the lead and that the person responsible for it is. And if there's anything that you see, and if there's something, and if you didn't have an opportunity to go through it prior to today, you can always still reach out to myself or Sherry with your comments and questions, and we will gladly answer them to the best of our ability. But this is our strategic plan that we've worked on. And if I don't see any hands, do we have any questions at this time for our strategic plan that we're presenting to the board this morning for your approval? I see no hands. Any comments? We also take compliments because we worked hard on this. Any comments? Any questions? Having no comments and questions about the strategic plan that's presented before you, I'll entertain a motion to approve.
I'll make a motion to approve.
Is there a
I will
second?
second.
Okay, Mrs.
Second.
Small has seconded the strategic plan. And again, everybody, if you haven't had the opportunity, there's really some good stuff in there that we are certain is going to improve some of the policies as well as the reputation of COC. And we look forward to implementing those and you witnessing what it is that we strategically put together in creating this plan. So I want to thank everybody that actually participated with putting this together. HLA and its staff has been awesome. But again, this was a process we didn't just start last week. We've been working on this for a while. Sherry, is there anything that you want to add to that?
No, I just want to second what you just said, and also that we had a work group. There were many interviews that were conducted by a consultant who came in and received all the documentation, all the data that we'd been collecting, all the survey responses and needs that we've shared with him. And he put all that together. And then, of course, there were surveys that went out again as well. But this was the work group went very well. And I want to just point out that if you look at pay attention to who is leading. The assignments are given to committees. And I think that as anyone who's involved in a committee, this is going to help with that annual work plan that committees are supposed to come up with. And we know that busy people are productive people. And so, especially when we have this discipline and actual focus and guidance moving us forward. And so I am excited about that. This is a plan that all of us implement. And so there will be more discussion around that within committees and of course within executive committee following this on how to go about that process.
All right, thank you. Any comments?
Yeah, this is thorough. This is reflective of a better process. I encourage everyone to review it so that, it kind of helps to understand what we're doing, why we're doing it. And thank you for everyone who did work on this.
Thank you, Michael. So I see no hands, but again, I'm so thankful that we're looking ahead, forward thinking, and this is where we're going to go from this moment on. So I do appreciate everybody that had something to do with that. So now we're moving on to item 10, which is our HLA lead agency update. And again, that will be you, Ms. Sherry.
Okay, and just in case, because I may have blanked out for a moment, did we have a vote on the strategic plan? I know we
Oh,
had.
no, we did not. No, we didn't. I just assumed y'all liked it.
That's what I figured too.
I just assumed you all liked it. Is there a motion on the floor to accept the strategic plan? I didn't hear it.
So moved.
I'll put a motion.
Ms. Jones, and then Mr. Small, would you mind seconding that?
Yes, I'll second that.
Okay, so for the minutes, Ms. Jones and Mr. Small, all in favor of the COC strategic plan, say aye.
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 Those opposed? And if you have not received it, the motion passes. If you have not reviewed it, please do. Please take an opportunity. I know we're busy people, but please take the opportunity to review the strategic plan, because I think you will be very impressed with some of the items that we are going to actively be working on. Okay, now, Ms. Sherry, we're going to go to item 10. Thank you so much for that.
Oh, thank you. The HLA lead agency update. So COC reporting and compliance, just so that the board knows exactly what we are doing and that everything is on track. We just passed the COC plan. We will be submitting that July 15th on time to Department of Children and Family Services and reviewing it annually at least. We will be reviewing it at every meeting to see how we are moving forward on that plan. But it can be updated. And so I feel wonderful being able to submit something that is complete and ready to go. We have also on July 15th, we are well on our way to submitting our CAPER report on behalf of the COC. CAPER is Consolidated Annual Performance and Evaluation Report. I needed to look that up. I apologize for all of the acronyms here. We also are completing monitoring. We've completed the monitoring for the the HUD funded projects for the COC. So that'd be with BOLI, CASA. We are now, though, in the process of doing exit interviews. So just to give the projects, the agencies an opportunity to meet and discuss the findings and strengths that we've encountered. We are holding on sharing that until the next board meeting. Then everyone will receive a condensed version of an overview of any findings and strengths and recommendations moving forward. The governance charter, we are submitting that July 15th. It has seen many many adjustments, amendments over the years, and it was approved for its 5-year approval period by the general membership, as well as annually it's approved by the board. We will be having, as interim chair Deborah Fix-Sanders has mentioned, more work being done on cleaning up that charter. However, it is ready to be sent up to DCF as well on the 15th. And finally, disaster policy. We have a disaster plan for the COC. The HLA works with the Pinellas County Human Services as well as the Emergency Operations Center on disaster planning. We held 3 sessions getting ready for the hurricane season, and which was launched June 1st. And this helps to make sure that all partners are convened whenever there is a disaster about to happen, and know where the resources are, communications happening very well, and updates are going out to people who are unhoused, especially making sure that everyone can find shelter and place for safety in the event of a major disaster or a hurricane. So one thing that we are doing is we're working with, we've worked with a HUD TA, the disaster experts. And we're taking our existing plan that hasn't had major updates. We've been working on updates this year. We're taking it to them and workshopping this along with the county and Emergency Operations Center. And so we'll be able to share that soon as well. And that is it for compliance, and wanted to just make sure everyone knew what was happening behind the scenes and that all the requirements are being met so you can sleep well tonight. COC program monitoring, I already went over that. And PIT report update. The actual PIT report is submitted and hit, when I say PIT, point in time plan, the point in time survey, those results are submitted to HUD and to DCF, the state. And so that's considered, yes, we've completed that report. Pinellas County, we have our own special report that is there's more analysis involved. And this year, like last year, Dr. Freeman Gerhardt is the author of that report, and he held a 1-hour session with anyone who was willing to show, and we had a good showing, to get any input before that report is finalized, what people want to see, areas that may be, it's a lengthy report, areas that could be cut back. And also what I'm excited about is that there's some more information on our housing inventory going along with this report, which it does work side by side. So that's coming from HMIS data, which is not just a point in time necessarily. It just trying to infuse more of our data that we have throughout the year in that report. But I wanted to share the numbers of people who were surveyed. We had total sheltered was 1,314. When it says sheltered, that means someone's in emergency shelter, transitional housing. That decreased 11 from last year. And then this year, our unsheltered count went up to 635. That increased 97 from 2025. I just want to caution that these numbers don't necessarily reflect anything without further analysis. There's other things, context to be considered, such as there was a cold night shelter activated the night before PIT, which means that you have more people congregated in one area at cold night shelter sites. So it was easier to reach people at that point. That doesn't necessarily explain the increase, but it is something to consider. And so Dr. Gerhardt will be presenting that report during the September board meeting.
Okay, well, thank you, Sherry. Any questions, any comments in regards to the report? I see no hands raised. You all are quiet this morning, or are we just that informative? Okay, so I still see no hands being raised, so that's good. So now we're going to go ahead and move into the next item. Thank you, Sherry, for that. I think you just did a phenomenal job. That's what it is. You did a great job. Thank you. So now we're going to move into our council and committee reports by our committee chairs. And now we're going to also have the report from the Funders Council, which is Chair Sandra Newsom, who is on, as well as Vice Chair Errol Woodard. Good morning, ladies.
Good morning. Good morning, everyone. And first, I want to thank all the members of the Funders Council who have participated both in an in-person meeting recently and a virtual meeting to finalize some of the items that we want to bring forth to you all. Sherry covered the change of the language, so thank you, Sherry. So I'm just going to turn it over to Arrow.
Hello, thank you. And we're so happy to have Sandra at the helm for Funders Council now. Appreciate that. So one of the things Funders Council has been working on is really doing an assessment again of funds in the system. We're still hashing through it and refining just to make sure we have accurate data and include all the different types of funders and so forth in that list to really take a look at where the investment lies and overall, at to what level. What we are seeing, though, is that there is a significant amount of the funding that is from one-time, non-recurring sources. A lot of it, we had pandemic money that was in our system, and then right back to back with 2 hurricanes that brought extra money into help either prevent homelessness or address, get people back housed. And so that's something we're kind of really watching closely, because that is we've been kind of reliant on having those extra funds in our countywide system since 2020, and what impact that could potentially have as those funds dwindle down. And so, yeah, that's kind of where we're at. We're still kind of hashing through the numbers and everything to make sure that we've got an accurate picture that we can monitor along the way for that.
Okay, thank you, Ms. Jones.
Thank you, Madam Chair. A question for Arrow and Sandra. Was there any discussion, or do you anticipate having discussion related to the proposed tax reform bills or vote that will be coming up in the fall, as to how that may impact the funds that come particularly from local government sources?
We actually discussed that at our last meeting to go ahead and add a column that specifically not just says what the funding source is, but if it's local, federal, or state, so that we could kind of narrow that down a little bit to look at, we know we have our one-time investments, and then looking at what does that local, funding level look like that could potentially be impacted if there are cuts to property taxes.
Thank you.
Thank you. Any other questions for Arrow or Sandra? Thank you, ladies. Okay, I see no hands raised. And Mimi, you're going to have to help me watch the screen, but I see no further questions for the Funders Council's report. Next, we're going to move into our PIT planning report, and Sherry is going to handle that for Ms. Dominique Random.
Yes, so PIT Planning Committee, everyone is welcome to join that committee, and it's several subcommittees too. So there's lots of work that happens around PIT, and it begins in August. So the first planning committee is going to reconvene on August 4th, 9:30 at First Contact, otherwise known as 211, and it is a hybrid meeting, so it's in person and virtual. And they are looking for new members and active participants for various subcommittees. And so I'm going to share those subcommittees: marketing, youth, law enforcement, training, survey development, and deployment. Again, very active committee, active work. So when people are getting involved in committee work, just remember the work part of it. You can come in, bring your gifts, your skills, and give it a shot. But whatever you are able to participate in, whether it be just volunteering to be a PIT survey taker during the actual PIT count, that's another way to get involved as well. Sharing any marketing materials that go out through social media, or constant contact to your social media and with your networks also helps. So if you have any questions, then you can send them over to Dominique. Or Alex Strider, if you email info@hlapinellas.org or send it to me, we'll make sure it gets to the right people.
All right. Thank you, Sherry. Any questions on the PIT planning and those awesome committees that she listed? And even if you didn't take notes, they're going to be listed in the minutes. So when you do receive the minutes, you'll have those committees. Thank you again, Sherry. So now we're going to go ahead and move in item 12, which is our open discussion. And this is where everybody can participate. And what we wanted to do was take a couple of minutes to allow you to share any success stories, because what we do is hard work. But what we do is meaningful work. It is something that has to be done. And we'll open the floor up now for anyone that would like to share a success story or something that you positively experienced based on your work with our unhoused. And the floor is open. Hands raised. Because you all work too hard not to have had a success story. I see everybody's faces looking here, looking there. So a success story today for us at COC is that we actually approved our strategic plan, and that we actually approved, new board members. And I'm looking forward to what the end of the year is going to bring, as well as 2027. I see two hands, Miss Helen Rhymes. If you can unmute yourself. Hi,
Good
Helen.
morning. Hello. So I didn't want to leave us without having a success story because you're right, we do have a lot of them. But I wanted to give a huge shout out to Lieutenant Haish. I call him my best friend. I tell him all the time when I call him, he better not tell me no. And he rarely does. But in our community, we received a call about a young lady who is legally blind, who was unhoused. The church had put her up in a hotel for the night. I think our call team was involved with her as well. And DCF was involved, and they were really just saying she was going to be unhoused. Like, there's nothing we could do about it. She's just going to be unhoused on the streets. I pushed back a little bit with them and said, hey, we need to make sure she's safe. We can't just leave her out here. She is vulnerable. What can you all do? They could not get her into an ALF. She did not meet the criteria for an ALF, and her home life that she came from was not safe according to her. And they were sending her to safe harbor and just dropping her off, like, just go figure it out. I called Lieutenant Haish. We went back and forth for a little bit on making sure that she was safe, and he did take her in, make sure she was safe for that night, for her to go over to Pinellas Hope. And I think that she is there now in a cottage, pay, because she does have some income, very minimal, but some. And I think they're working with her to get her back into safe housing. But ultimately, I guess it just shows how our system works and how our team works, how we work together as a team. And so Lieutenant Haish is just amazing. Every time I call him with a problem, he helps fix my life. Because they are bigger problems. It doesn't have to be a call because anybody could go to Safe Harbor, and we know that, right? But these are bigger calls like, hey, I really need eyes on this person, or this person needs to come here. And they've agreed to it. How can we work together to make sure they're successful? So thank you so much for that.
Wow, thank you. Thank you, Lieutenant Hayes, for that. We do appreciate that. And thank you for sharing that, Helen. The next hand I saw up was Miss Arrow Woodard.
Hello, I'll share one from our one of our outreach, or our one outreach officer. He's still fairly new in the position and really diving in, but he came across a mother and her, I think it was 3 children, literally sitting on the side of 19, and kind of, took it upon himself to really make sure that they got in a safe place. Ended up being able to get them reunited with grandma and living with her. And, he said the kids in the car just started lighting up and opening up because they remembered that neighborhood when they were younger and had good memories in that area. And so he was super excited to be able to take them, from the street and actually get them placed with family members that they are now in a safer spot.
Wow, that's deep, especially children. Thank you for sharing that, Arrow. Thank you. Next, we have Miss Loriana from CASA. Hi, Loriana.
Good morning. Thank you for the opportunity to share. I just wanted to say we opened our Family Justice Center in downtown St. Pete a few years ago. The Family Justice Center is a collaborative model where we have different partners on site to make it easy for survivors to gain access to services, including all of our housing programs. This model was started in San Diego through a group called Alliance for Hope. They've always operated their annual conference in San Diego, but this year they've decided to actually come to St. Petersburg to show off our Family Justice Center, the CASA Family Justice Center. So in early November, November 3rd, 4th, and 5th, they will be having their national conference, bringing in 500 people from around the world to learn more about our Family Justice Center and all of the programs that we offer. So very excited about that.
Yeah, please keep us informed and updated on that for those of us that would love to celebrate with you. Thank you so much. Congratulations.
Thank
Yay, that is huge. That is huge. Congratulations.
you.
Okay, now I may say okay, those were applause. I thought it was a hands up. So we're gonna go ahead and you probably ask, why did we want to tell success stories? But when we talk about, we hear all of these things that are going on with conversations with COC, with the police department, with the fire department, with other social agencies, and we hear about all of the really horrible things that are going on in our city. But there are definitely also some goals at the part of the at the end of the rainbow where we actually have success stories where the meaning of what we do are very important. So we wanted to at least be able to leave the meeting highlighting some of the benefits of the work that we do. So I saw two more hands come up. I see Mr. Smiley Joseph, and then Kevin, saw your hand next. Mr. Joseph.
Thank you, Madam Chair. In light of your appeal about the good things that are taking place and citing some of them, thank you so much for that. I would just make mention that Mount Olive AMA Church is doing an incredible job with the homeless and the feeding of the homeless at least twice a month. And the numbers that are coming along Pinellas Trail, North County, those numbers are increasing just dramatically. You're seeing the homeless that are going down the trail. But I just would like to have the group to know that the church has expanded that work and the number of feedings that are taking place is increasing, and we're thankful for that. So we just want to report that we're proud that that's taking place, and we expect to be in a better position to feed even more, because I suspect those numbers are going to continue to get larger.
Thank you so much for that. Thank you, thank you, thank you. Your work is not in vain, and we do appreciate it. Thank you so much. Mr. Kevin.
Yes, good morning. I was just excited to report that Boley Centers started construction this week on Lealman Landing, which is our new housing project with 17 units. So we're excited to get that project moving. Grateful to the to the Pinellas County Housing Authority for their partnership for project-based vouchers for this project, which is going to make this an affordable project for those that reside here. So,
Okay, thank you. And we're excited. I know I'm excited for you. I appreciate it. Thank you. Okay, I see no more hands up because Ms. Woodard, I think your hand is still up from the last time. I see no more. Let me make sure. And if I'm overlooking you, please
Sandra just came up.
Whose hand?
Hi, it's me again. I just have a quick announcement. Florida Supportive Housing Coalition is hosting their annual summit in Orlando on October 5th and 6th. And our own April Lott has agreed to open up our session as our keynote speaker. So I'll send information to Sherry to share with the COC, but would love to see your faces there if you're able to come. The focus of this conference, unlike all the other ones, is strictly on supportive housing. And we will be working with Florida Housing Finance on doing a lot of workshops around some of the changes and how we can continue to operate supportive housing in a environment that's not as pro-supportive housing as it once was. So stay tuned, but hope to see you there, and you can reach out to me if you are interested in participating on a panel or you want more information. That's it. Thank you.
All right, thank you so much. So since Ms. Sandra just transitioned us into announcements, does anyone else have any other announcements?
Oh, sorry.
No, you're good. No, you perfect timing. Perfect timing. Does anyone else have any other announcements that they would like to share? And if you do have anything that you want to send to Sherry or to Mimi for us to distribute, we'd be glad to do that. And just to remind us of any upcoming events that you have so we can actually communicate with the rest of COC, especially those that are not here today. So Errol's hand is down. Sandra just made her comments. So now I don't think we have any public comment, do we, Mimi?
I don't think so. Does anybody have
Okay.
a comment?
All right. Well, does anyone else have any comments, questions, feedback from today? Anything that for the good of the body that you would like to speak at this time? Come on, you're amongst family.
I have just one thing I just wanted to share out. So we've still been meeting, having our countywide street outreach meetings. It's been pretty productive. We're going to really start diving into more training and education. So on our last meeting, we kind of mapped out what are the areas that street outreach sees as gaps with the clients that they serve. and just wanted to share out it continues to be a major issue for our system of people with disabling conditions, physical disabilities that cannot sleep on cots, that cannot sleep on bunk beds, and so they are literally not able to find a place for shelter. So our street outreach, is making an urgent plea that we've got to figure out in our system how to serve those that have that medical fragility. And then the other big thing that they asked for, which is probably something more easily doable, is just really creating a shared information area where we have all the intake procedures for the different shelters that are out there and other resources, so everyone's not kind of in their own silo for having to do that research again and again and again. So those are some of the big things that we're working on in that group. And that each agency involved is kind of taking on a month to present and facilitate and pick the topic for that month too. So they're really taking some ownership in it with themselves. Awesome.
Okay, thank you, Errol, for that. Thank you. I think I see Michael's hand.
Super quick, I just want to say thank you to our new chair for, as always, running a succinct, direct, and efficient meeting.
I know y'all are booked or busy, so I want to make sure that we use your time wisely. Thank you so much for that. I appreciate it. Thank you so much.
I have one thing to add. Michael, this might be a better announcement for you to make, but the upcoming Showcase of Services event on August 6th.
Sure, we're having our annual event at the Coliseum in St. Petersburg on August 6th. We've got probably right around 50 providers, and we should have 30 to 40 employers. August 6th, 10 to 2. So if you're interested in learning more information, just reach out.
And it's always an awesome event. The showcase is always awesome. So if you have the opportunity to participate, please do. And can we please send out a reminder? I need to make sure that that's on my calendar as well.
Will do.
Thank you so much. So I see no further hands. I see no one requesting additional comments. Our next meeting is going to be on September 4th. And I'm going to ask, since it is 10:06 before we adjourn, the executive committee, I know we're scheduled to meet at 11, but I'm going to ask you to hang on so we can go ahead and move right into our executive committee meeting. And for the rest of you, thank you for your vote of confidence on this. And I hope that we actually gave you efficiency in time, but that you're taking something away with what COC, our mission and our vision for our unhoused and the services that we provide. So with that being said, the meeting is officially adjourned. Thank you, everybody.
Thank you all.
Bye-bye. Have a good weekend.
You too. Bye-bye.